Greetings and welcome to the Christ Apostolic Temple COVID-19 Vaccination Roundtable. I'm Tim Goodhall with Hy-Vee. I'm a pharmacy supervisor for the Central Region. I'll be your moderator today. We have with us the following participants. Dr. Walter Mulganey with psychiatry at Broadlawns and Unity Point. Dr. Adriana Mitchell, also psychiatry at Broadlawns and Unity Point. Rick Terranova, who's a therapist at Broadlawns Medical Center. And then to my left, I've got April May, immunization program director at Primary Health. Dr. Elizabeth Peatland with Mercy One. And Shelby Simpson with the clinic. She's a clinical trial manager at Integrated Clinical Trial Services. So the first question that we have today are, what are some concerns that seniors who are reluctant to go for COVID-19 shots?
Seniors might be reluctant because of maybe they are thinking of some side effects of the COVID vaccine. There are some worries of uncertainty, I think also lack of information can be a reason why they don't want to get some vaccination. There are many other aspects to look into and more of collaboration and giving more information to them so that they can learn about the COVID-19 vaccination so that we can have that going for them.
And exactly why are seniors hesitant? Any thoughts on that?
I've found that most seniors are more hesitant because of the side effects. They're concerned that the side effects will take days away from them, that they'll get too ill, or that they can even catch COVID from the vaccine. And just sitting and talking to anyone, seniors especially, and just letting them know that the side effects are much less than the effects of COVID and the things that we can do to help with the side effects, the ibuprofen, rest, plenty of fluids, even something as simple as a ice pack on your arm can be very beneficial. But especially for seniors, they just have some hesitancy in general about vaccines. They've gone most of their lives without vaccines, so why do they need the COVID vaccine? And really, it's important just to talk to people.
I think that some of it could be maybe they fear because of their pre-existing conditions too, or maybe even interactions with some of their other medications. What do you guys think about that?
It's possible. It's a possible issue that seniors can be afraid of. And it's something to talk to your practitioners, your nurses, and
Definitely.
just kind of try to look for the truth about these vaccinations. It's potentially something that is not true, And if you look at most of the details about the COVID-19 vaccination, it's very helpful to many people, and we have seen that. And I think it's more of education and education.
I think we talked a lot about that developing the non-judgmental trust.
Yeah.
Yep.
As a physician, I really want to have that non-judgmental conversation about, what are your worries? What have you heard and what questions can I answer? I'm not going to try and scare you into getting the vaccine or tell you what to do. I just want to give you the best information so you can make the right decision for yourself.
And just coming from a standpoint of being African American, there's been a lot of, times in the past where there's been some distrust for the government, particularly for the African American community. So just educating, making sure they understand and giving them that, additional education on the vaccine itself.
I think the non-judgmental aspect is really important because we all do things that we could be judged for, I guess, in a medical situation, right? But I don't think it helps change anyone's mind if that's how you come across. I think it's much more effective to approach it from the perspective of giving knowledge that is non-biased and it's just like, well, here's the information, and then allowing them to make their own decisions. Because at the end of the day, they're adults that should have autonomy over their own choices.
Yeah, I agree. I just want to provide, accurate information so that people can make their own decisions, because there is a lot of non-accurate information out there.
And any other advice you could give for seniors that are hesitant?
I think if your physician doesn't start that conversation, feel free to start it yourself. Say you have questions about vaccines, and they'll be more than happy to answer those questions for you.
Oftentimes our seniors see their pharmacists more often than they see their physicians. So
Very true.
the physicians and the pharmacists being able to have that developed trust relationship, I think it's very important.
Yes, absolutely. Yep. A pharmacy is a really good time for seniors to. So we'll kind of switch gears a little bit. So, Dr. Peatland, what are some of the challenges rural residents are facing when it comes to being vaccinated?
Yeah, so we've seen that our rural communities are actually getting hit harder by COVID, even though the perception is that they're not. They're getting hit harder because we don't have the staff to help support them. So, a lot of rural hospitals have less beds, less physicians, and less nurses. And so when they are getting these COVID surges, they don't have the staff to help their populations. And so I think a lot of the challenges are coming from a false perception that COVID doesn't affect smaller communities as bad as it does the big cities.
And then what are some of the concerns that rural residents have regarding the vaccine?
Yeah, so I think a lot of people are hesitant because of false information that they've gotten, along with their concern about whether or not they'll get COVID. Like I said, I feel like there's this perception out there in smaller towns that I don't have to worry as much because COVID's hitting the big cities harder than it's hitting my community.
And so, Dr. Peatland, to you again, can you explain what RSV is?
Yeah, so RSV is an illness that it presents like the common cold, but we can detect it a lot easier than the common cold, and we have seen it affect the extremes of age a lot more. So it tends to affect our young children less than 2 and our older adults a lot more. We see a lot of small children in the hospital with RSV bronchiolitis requiring oxygen and, supplemental feedings because they get so sick from this that they're not feeding well or they're not able to breathe well. And we have to provide them with additional treatments. It's a virus that's been around for a really long time, but it's hitting us especially hard this year.
Can we give vaccines for RSV?
We don't have vaccines for RSV, unfortunately. We do have for very select high-risk pediatric premature infants. We have a monoclonal antibody that we can give them, but it's very expensive and it's available in very limited quantities. So the best thing really is prevention of spread.
So how can citizens guard against the triple threat of COVID-19, flu, and RSV?
I think it's important that, especially as RSV is so sweeping right now, we need to be vaccinating against the things we can, like flu and COVID, so that we can reduce the hospitalizations from those so that we can better take care of those with RSV. I also think it's important that if you're sick, you should stay home. If you know you're going to be around people that are sick, wear a mask so that you cannot get sick yourself. These are all things that we can do to help prevent the spread of these things that we don't have vaccines for.
Wash your hands.
Yeah.
Don't kiss your babies.
Yes. Kissing babies. I tell all my patients with babies, I say they're so adorable and everybody wants to kiss them. Nobody should kiss a baby's face in the winter.
No, kiss their feet.
Yes.
I love it. And then can you speak of to the testing of really any of the three?
Yeah, so we actually have one test that can test for all three in most places. So flu, COVID, and RSV, and it's just one swab. So it's great. You don't have to get multiple swabs, and we know what we're treating. So we have different treatments for flu and COVID that we can start you on if we know that that's what you have.
Yep. And so, we're seeing football stadiums, shopping centers full of people, and just a few are wearing a mask. Is that an accurate reflection? Can we relax now?
I think what we're relying on really is people to be vigilant about how they are themselves, right? Because I wouldn't go as far as to say that we can relax, but we know quite a lot about how to help not only protect ourselves, but protect other people, which is different than a lot of other illnesses, So shopping malls, football stadiums are full, but if you're feeling ill, you got some kind of respiratory thing going on, you would hope people would be cognizant enough to sort of say, hey, I actually don't feel very well. I should probably wear a mask or stay home, like you mentioned. So vigilant, but Probably not relaxed.
I would say just use our best judgment to make sure that we're keeping ourselves safe and keeping people around us safe.
Okay. Yeah. So we'll kind of move on to some myths and misunderstandings about COVID-19 and the vaccine. So, some people have heard, the old wives' tales and assorted misinformation regarding COVID and the vaccine. So just what does science say about the vaccines, namely, COVID-19 itself? Rick, can you speak to, can the vaccine actually give you COVID?
The evidence says no. You'll probably, well, there's a likelihood you might have side effects. We mentioned that before, and some ways that you can kind of mitigate those side effects. When I had my COVID vaccine, the first one didn't feel a thing. Second one, I was kind of like, eh. The rest of them have been without incident, apart from a sore arm, which I think is pretty common with any vaccine, certainly that I've ever had. And I did have to have vaccines as well when I came to the US from the UK. So yeah, there's quite a lot of misinformation being propagated. We seem to live in an age of misinformation. Another one is, how is it going to affect fertility? There's, again, no evidence that it's going to affect fertility. Another one that I think, and this is actually from talking with people about this as well, at work as well as, not at work, about how it alters DNA. It does give information on how the body can protect itself, but then that is pretty much immediately broken down, so it doesn't have any further effect. That's kind of one of the more, I feel like, insidious kind of informations, because it sounds scientifically plausible. And there's a lot of information that sounds scientifically like, oh yeah, this kind of makes sense. Actually, it really doesn't. However, I think it was really interesting, Dr. Peterlin, that you brought up the myth, or the misinformation, or the misunderstanding about this is a big city disease. So people in rural communities kind of think, oh, I'm okay, I don't need to worry about it. Whereas actually, for what you're saying, and that actually is news to me as well, about that is actually hitting rural communities really hard. So I think that there's misinformation on both sides, right? So you've got the one that's kind of like, yeah, that's ridiculous. But then there's others that actually are really harmful. So I think we've got to be mindful of that.
Can we talk a little bit more about fertility? Because I know that we have a lot of patients that are concerned about getting the vaccine or giving their vaccine to their children that may want to have kids later, or pregnant women. Yeah. And I have always said pregnant women should have the vaccine.
Yes, absolutely. We highly encourage it in all of our patients that I see every day, that they get their COVID vaccine while pregnant. We think, based on what we're seeing, that moms who get the COVID vaccine can provide some protection to their baby. Just like we recommend the flu shot while you're pregnant. It's really important that we keep those young babies healthy as well.
What experience do you have with moms that haven't had the vaccine delivering early?
I've seen that. I've seen, unfortunately, moms who've had to deliver, we had to go to emergency C-section because mom's on a ventilator from COVID. Pregnancy suppresses your immune system because it has to keep the baby alive, because the baby is a foreign object to your body. And so your immune system would attack it if your immune system stayed at its normal level. So in order to have a healthy baby, your immune system is suppressed. And so COVID hits so much harder when you're pregnant, because it's an immunocompromised state, just like, medically induced immunocompromised states.
Yeah. And so that will kind of lead us into sort of our next topic. And in April, I'll ask you this one. Can you share some tips regarding kids and vaccinations? Can parents be comforted in knowing that their kids will be safe?
The CDC recommends vaccinations from ages 6 months and up. We now have the bivalent booster that goes, it's recommended everyone 5 and older get the bivalent booster. And the bivalent booster is a really great thing because it has some of that original vaccine in it, plus those Omicron variants, those variants that we can help protect. it's really important, I feel, that we get all our children vaccinated because then we protect more of the public. A lot of times we don't realize, because we can't tell the difference between a cold and RSV and influenza, that kids may have COVID and passing it around without even knowing. And it's really safe.
Yeah, I think there's this perception that, we came up with this vaccine so fast. We came up with this specific strain of the vaccine pretty quickly because we needed to. But this technology has been around for a long time. We just didn't have an applicable virus to use it for. The way that a normal cold virus works, it mutates too fast for an mRNA vaccine to be effective. But we've had the technology behind mRNA vaccines for many years. We just are getting to use it now, which is great that we have, we developed this technology because we used it when we could.
Yeah, and I'll just add that the bivalent booster is just on the horizon, all the way down to age 6 months as well.
So we're just waiting.
Very, very, very near. Yep. Then what about the dosage for kids?
Kids' dose goes by their age. It doesn't go by their weight or their size. It goes by their age. And we do have some specific guidelines that the CDC recommends. They get a smaller dose. And if they age into another age group during that time, we do have recommendations that we can follow. We do have a choice between Moderna and Pfizer, just like we do for adults. So that's always great for parents to have a choice with their kids' vaccines.
Yep. And then can the vaccine affect a teenager's heart? Then
99% of the time, no. There's that 1% that have had it happen to, and we are cautious sometimes about the spacing of how soon we give the vaccine in teenage boys, especially. But for the most part, no. And I think that we can speak to the side effects or the after effects of COVID in children are much worse than that 1% chance. The after effects are much higher than that 1% chance of a little bit of inflammation of the heart that we can treat with ibuprofen and careful watch.
Well, and we've seen that same effect happen from COVID itself. This isn't unique to the vaccine. It affects children's hearts just like those rare side effects in the heart from the vaccine. I've seen personally cases of sick children, not from COVID itself, but from the side effects of the body reacting to the COVID. I've seen children end up in the ICU because they got so sick after they got better from the virus, just from the effects it had on the body.
The benefits definitely outweigh those.
Yeah. And then how about fertility in children? Can it affect fertility?
We haven't found that it affects fertility in children at all.
I think the fertility comes from a not understanding how our body processes the mRNA that's in the vaccine. And there was thought that would be passed on, but like we talked earlier, it's gone almost immediately.
Okay. And then kind of sticking with children, have you seen, can the side effects, interfere with school or sports? Have you seen any of that?
One of the best things I always say to parents when the kids get their vaccine is they need to do chores. They need to move those arms. Make them do the dishes because moving that arm, just like like your booster for your Tdap, your flu shot or anything, move that arm or put an ice pack on it. I'll tell the kiddos, it'll feel like your sister hit you, but that's okay. Just put an ice pack on it. Have mom give you some Tylenol. I always feel like ice cream fixes everything too. If you give them ice cream, they'll get distracted.
You may not want to get it the day of like a huge sporting event. Pick another day to get it. But I think it's still definitely. It's a day or two of side effects, and then you're better.
Mm-hmm.
Yeah, and I always like to tell my patients too that fever is actually a good thing.
Fever is a great thing.
Okay, so we'll switch gears again and kind of talk about clinical trials a little bit. So Shelby, what is a clinical trial and why are they important?
So clinical trials are a type of research study to test and gain information about new treatments. So it takes on average about 12 to 15 years to get a new medication all the way through clinical trial phases. And then at that point, it's proven to be effective. We have a good profile of side effects. Who the medication should go to, and then it gets approved by the FDA to be prescribed. And clinical trials are very important for many reasons. First and foremost is just to have those treatment options, those new treatment options available. And then another is to satisfy an unmet need. And what I mean by that is, say there's someone with a condition that doesn't necessarily have a treatment at this point, or it could even be a condition more common, but then people maybe don't respond well to the therapies that are out there and available right now yet for it. But ultimately, the goal is to increase community health and have more healthcare opportunities available to people.
So are there any clinical trials to study long COVID?
Yes. So at Integrated Clinical Trial Services, we are a clinic in West Des Moines that's been around for about 20 years. And we are looking into some long COVID stuff right now. So the CDC identifies long COVID as signs or symptoms that develop after the COVID-19 acute infection has left your body. And some of these symptoms can be chronic fatigue, it could be brain fog, respiratory issues, aches, general aches and pains. And then these last for weeks, months, or sometimes even longer than that. And up to 30% of people may develop long COVID. And actually, in April, the Department of Health and Human Services released this action plan. It's called the National Research Action Plan on Long COVID. And it's a nationwide effort to identify more about long COVID. What are all these symptoms? Who is getting affected by them? And then helping other community healthcare physicians how to best treat these patients, and then helping the patients and their families and themselves. How can we best identify resources for these people that are affected by long COVID?
So why should an individual volunteer for a clinical trial?
So our patients are volunteers, and they may receive compensation to help offset some of their time and travel expenses. They could receive relief from some of their symptoms related to whichever indication study that they're in. Now, that's not a guarantee because it's still in the clinical trial phase and the medication may not work for them. There's oftentimes a placebo component involved, but ultimately, what we tell our patients is they're really helping the greater good. They're seeing the bigger picture of, I know I'm making a difference to help future people that have the same condition that I'm suffering with. And I think that they really find comfort in that. And another important topic that I'd like to touch on is diversity in clinical trials. It has been huge recently. People of different ages, genders, races, and ethnicities respond differently to medications. So the FDA is actually giving a bigger push now to have a certain percentage of diversity in every single clinical trial. And that way they're really moving towards that health equity.
So are they safe? Are clinical trials safe?
So there's a stigma associated around clinical trials. And I think that this fear factor can be curbed a little bit by community education. So this industry is actually very heavily regulated, and I like to view it more as a resource instead of a fear. So there are...
Is it not true that sometimes you use medications that we know of to do some clinical trials for other disorders? Is that not true?
Yes, yeah. We do clinical trials for many different indications.
Yeah.
So really, the sky's the limit. We've done for so many different migraines, fibromyalgia. We've done gastroparesis. Long COVID is the big one that we've been focusing on most recently.
And most of the time when you're doing these clinical trials, I think you try to use the medications that we know about that we use for other indications. Is that not correct? For example, some people can use like Tylenol to look for another indication for it.
Right.
Or other medications that we really know about and we know that they are safer, but you do integrate them in clinical trials. Is that not true?
Yes, yes. So we can take medications that have been approved for a certain indication, and then we can change the route of administration. We can tweak the dosage, and we can try and administer it for a different indication. And it can really jump spectrums too.
Sure.
Lots of different inflammatory disorders can use monoclonal antibodies because they're all that immunosuppression, and that's how that it could work very broad spectrum for many different indications.
And trials are supervised both locally and nationally for safety.
Yes.
So that if we do find that something's unsafe, we stop it.
Yes.
So that we're not hurting patients.
Mm-hmm. It's a very heavily regulated industry. And it starts with a pharmaceutical company and they're creating a new medication. And then with that, they create a protocol or a book of guidelines. And this must be followed to a T. It says who can participate in the study and who can't. And that's just for their patient safety. So there's also regulatory authorities and third-party organizations that are coming to clinics like us and just making sure that everything is being followed per protocol for, patient safety and human rights. And all of our physicians and other healthcare providers at Integrated Clinical Trial Services, we're actually in maybe a little bit more communication with our patients, more so than a typical primary care physician, because we really want to keep a close eye on any changes in health changes in medications as they move through the clinical trial process.
And maybe to give some light, I believe you do a lot of work, and these trials go through many phases before we utilize them.
Mm-hmm.
Do you want to shed some light?
Yep. So there are 4 different phases of clinical trials. So they'll do just cellular level. And if a cell doesn't survive after being exposed to a certain ingredient, then obviously that's a bad place to start. But once it gets beyond that, then you can test the medication on healthy volunteers who are less likely to experience side effects. After that, then we start looking at, okay, well, how will this medication work for people with migraines or other neurological issues, indications? And then you're tweaking the dose adjustment in some of the later phase clinical trials. And one of the last steps is to identify any long-term safety effects and see if it needs to be extended from there. And then that's usually when it gets approved by the FDA. Also, they can compare it to other common medications for the same indication to prove which one is superior.
Thank you. And that's just to say that the clinical trials, you have a lot of phases, a lot of testing, a lot of safety, procedures to go through before we release these trials to the public for vaccination. And I think that's where COVID-19 vaccine has gone through those processes. And I appreciate you sharing that information.
Mm-hmm. Thank you. Excellent question.
Yeah, thank you so much, because I think that's important to make sure that the public knows that safety is priority when you're completing these clinical trials.
Okay. Well, thank you everybody for joining us, and we'll see you next time.
Thank you.
Thank you.
Thank you.